Viral pathogen coronavirus presentation by Dalha Faisal. This is a picture of Covid-19 under a microscope. Looks like a fuzzy sphere. Description of coronavirus. Coronavirus is a very contagious disease that spreads very easily. A lot of the people who catch Covid-19 experience a mild illness. For older people and people with already existing medical conditions, Covid-19 can be very fatal. Covid-19 mainly attacks the respiratory system and around 80% of the population only experience a little bit of pain. Since the virus spreads easily, it is best that people take care of their hygiene and when they go outside, wear a mask and stay 6 feet apart. One of the ways that Covid-19 spreads is when a infected person sneezes or coughs and doesn't cover their mouth. History of coronavirus. The first cases of coronavirus appeared in Wuhan City, China on December of 2019. At first, the disease wasn't taken too seriously and people all over the internet kept mocking it. After just a little while, the disease just kept spreading and showed no sign of stopping. Countless of lives were taken away by the coronavirus, and by March 2020, the World Health Organization declared COVID-19 a global pandemic. People all around the world have been stuck in their houses with not many activities for them to occupy themselves with since then. This virus has caused a lot of people to fall into depression, and it just keeps getting worse as the days pass. A vaccine for the coronavirus disease is in the works, but there is no exact completion date that has been given. All the people can do is wait and see what happens next. COVID-19 has been a mysterious surprise that nobody expected anything of, but it ended up changing how the world works drastically. Symptoms of COVID-19. The most common symptoms is fever, dry cough, tiredness. Less common symptoms: a skin rash, finger or toe gets brown spots, pain and aches, sore throat, headaches, taste or odor loss. Serious symptoms: having a hard time breathing or shortness of breath, pain in the chest or pressure on chest, losing the ability to speak or move normally. How it spreads. COVID-19 is spread by direct and indirect contact for the most part. Coughing, sneezing, and breathing heavily from an infected person can easily help spread the disease if another person is within a 1 meter radius. If an infected person touches something and then a non-infected person proceeds to touch the same thing and not wash themselves afterwards, then the disease indirectly spreads to them as well. If the virus manages to reach the mouth, nose, or eyes, then it easily spreads to the rest of the body. When you touch something, always wash your hands afterwards because you never know how contaminated the things you touched are. What does coronavirus do when it enters the body? If the virus enters the body, when it hits the air passages on the outside of the lungs, it can cause pain. In and out of the lungs, these passages handle air. The virus harms the passageway lining and the body reacts with an infection that in turn irritates the lining of the nerves. This all happens when an infected person is coughing. If the virus goes past the lining of the airways and enters the air sacs at the end of the air passages, the infection may be more serious. Named alveoli, the exchange of gas in the lungs is the responsibility of these sacs. The sacs react with inflammatory fluids which fill the air sacs if they get infected. The statistics. In Canada, 714,000 people have been affected, 623,000 have recovered, and 18,120 people have died. In the whole world, there have been 95.5 million people that have been affected, 52.6 million people have survived, and 2.4 million have died. Countries like United States and India have the most cases because most people in these countries are not following the COVID-19 guidelines slash regulations. How it is treated. There isn't any sort of cure that is being given to people, but there is a vaccine that is in the works. It is not yet completed, but people are hopeful that it will be soon. As of now, people with mild symptoms are to take care of themselves at home since for them it is not too serious. All they have to do is eat nutritious food, stay isolated for at least 2 weeks, and make sure they are getting some good rest. If a person has serious symptoms, then it is best to go to the hospital immediately and get medical attention from the doctor and nurses working there. Fun facts: in COVID-19, the CO stands for corona, the VI stands for virus, and the D stands for disease. The name coronavirus is originated from Latin corona, which means crown or wreath. COVID-19 is treated in the same way as a normal flu by staying home and resting. Statistics show that on average someone who is infected manages to infect 2 to 4 people who are healthy. New coronavirus means that scientists and ourselves have never seen this virus before. Bibliography, and that's it.